of stress. He criticized school routines that force children to wake up extremely early and spend long hours communicating and studying, urging that the lack of sleep is negatively affecting children's brain and development and also their emotional well-being. Lawmakers questioned that the shortage of mental health professionals in schools and mental health centers across the country is one that is making the cost a bit further. According to the officials, Uganda currently allocates only about 1% of its national health budget to mental health services, despite millions of Ugandans reportedly living with mental health conditions. Parliamentarians further revealed that the country has only 14 psychiatrists serving a population nearly 48 million people, with most specialists concentrated in urban areas and less in rural areas. At Butabika National Referral Mental Hospital, mental health experts say that patient numbers have sharply increased in the recent years, especially among young people. And principal clinical physiologist James Roger Nsereko revealed that mental health cases at the facility have nearly doubled, but partly driven by the rising substance abuse among the youth. He also noted that many young people develop drug addiction and psychiatric after turning to substances such as marijuana during the COVID-19 lockdown period. And mental health advocates also highlighted that family instability has a major contributor to the emotional distress among children, citing domestic violence, neglect, separation, and excessive parental expectations. Meanwhile, the suicidal prevention advocates expressed concern over increasing suicide cases among the adolescents, particularly during the exam result periods. They are now calling for stronger mental health investments and professional counselors in schools, also specialized addiction treatment centers in regional hospitals, and discrimination of the attempted suicide to encourage vulnerable young people to seek help without fear. Mental health experts say that protecting children's emotional well-being must become a national priority, warning that without urgent action, the country risks losing an entire generation to a silent physiological suffering. Now, moving on to our next story, health experts in Uganda are raising concern over the growing number of children being diagnosed with cancer, warning that delayed diagnosis and incomplete treatment are putting many young lives at risk. As preparations continue for the 4th edition of the Children Cancer Run 2026, medical specialists and child cancer advocates say that more than 300 children are diagnosed with cancer in Uganda every year. However, experts warn that many parents either delay seeking medical attention or fail to complete treatment once it begins, greatly reducing the survival chances for the affected children. Speaking during the launch of the run, Dr. Irene Nansubuga, an ophthalmologist at the Uganda Cancer Institute, said that many Ugandans still wrongly believe that cancer only affects adults. She explained that several cancers commonly affect children, including leukemia, eye cancer, and cancers linked to the blood and the genetic disorders. Dr. Nansubuga emphasized that children cancer is treatable, especially when detected early and managed consistently through proper medical care. She urged parents and guardians to remain alert to the usual symptoms in children and seek immediate medical attention whenever the concerns arise. Meanwhile, the Uganda Child Cancer Foundation officially launched the 4th edition of the annual Cancer Run, scheduled to take place this month, May 17th, this year, 2026. According to the foundation's executive director, Moses Echodu, the initiative aims to raise funds for the treatment, care, and while also increasing public awareness about child cancer and the challenges families face during the treatment. He also revealed that many families struggle to afford transport, medication, and other treatment-related costs, forcing some children to discontinue care before completing the treatment. So next, there are many people who have joined the campaign saying that this partnership will help strengthen awareness efforts and also encourage more Ugandans to support children battling with cancer. Health advocates say that increasing awareness, early diagnosis, and stronger family support systems could help save the lives of thousands of children affected by cancer across Uganda. Now, moving on to our other story. Uganda and the United States have taken a major step towards strengthening healthcare cooperation following the launch of the new multi-billion-dollar health partnership aimed to improving disease control and health system resilience. In Kampala, the governments of Uganda and the United States have held a meeting of the new Joint Health Strengthening Committee, marking a key milestone in implementing a 5-year health partnership valued at approximately $2.3 billion. The committee is co-chaired by the U.S. Ambassador William W. Pope and Uganda's Minister of Health, Jane Ruth Aceng Osero. Officials say that this partnership will focus on combating the major infectious diseases, including malaria, HIV, stroke, AIDS, tuberculosis, and polio, while also strengthening the maternal and child health care systems. The agreement includes more than $1.7 billion in support from the United States and over $577 million in a core investment from Uganda over the next 5 years. According to both governments, the Joint Health Steering Committee will oversee the implementation of this partnership, ensure accountability, strengthen transparency, and align programs with Uganda's national health priorities. The partnership also aims to improve healthcare infrastructure, expand workforce capacity, strengthen disease surveillance systems, and transition more health programs from the donor-led support to the government ownership. Speaking during the meeting, Ambassador William Pope described the initiative as a strategic partnership focused on strengthening sustainable local health system and addressing disease threats at their source. Meanwhile, Minister Jane Ruth Aceng said that the partnership reflects Uganda's commitment to building a resilient and self-reliant healthcare system capable of serving communities more effectively. Health officials say that this success will not only be measured by the reduced disease burden, but also by the long-term improvements in healthcare system, the capacity and the community well-being at large. Also, the new partnership is expected to play a significant role in shaping Uganda's future healthcare system landscape, with both countries are pledging stronger coordination, transparency, and long-term investment in the public health. Now, moving on to our next story. Residents in Mpigi district are now calling for an urgent government intervention after a once functional health center in their community was abandoned and eventually turned into a tomato market. In Jalamba village, residents say that they have spent more than 2 decades without a reliable public health services after the area's government health facility fell into disuse. Community members said that the health center, too, constructed in 2001 and 2006, initially provided important services, including the antenatal care, child immunization, and the basic treatment. However, the facility reportedly operated for only a short period before being abandoned and left to deteriorate. Today, the once active health center stands partially depolluted and with parts of the structure now being used as a small tomato market by the local residents. Residents say that they converted the building into a trading space in an attempt to prevent it from completely wasting away while they continue hoping health services will one day return. Many community members said that the absence of a nearby government health care has left families depending on the herbal medicine and distant private clinics, which are often expensive and inaccessible, especially during the emergencies. Pregnant women and children are said to be among the most affected groups, with some residents reporting difficulties in accessing the antenatal care and immunization services due to the transport challenges. Residents also expressed concern about the emergency situations at night, saying nearby private clinics often close early, leaving critically ill patients with few options. And local leaders have also acknowledged the crisis, describing the condition of the abandoned facility as unacceptable. Officials said that restoring the functionality of Jalamba Health Center too should become a priority to ensure communities regain access to the essential medical services. Also, residents are now appealing to the government authorities to urgently rehabilitate the abandoned health center, warning that lack of accessible health care continues to place lives at risk in the community. Now, moving on to our global story. Global health experts are closely monitoring a recent hantavirus outbreak that has sparked fears online about the possibility of another pandemic. However, specialists say that there is currently no evidence that the virus possesses a COVID-19 style global threat. Health authorities across several countries are investigating a recent outbreak of the hantavirus linked to the cruise ship MV Honduras, where multiple infections and severe deaths have been reported. The outbreak has drawn international attention after passengers from different countries traveled aboard the vessel before cases were confirmed. According to the World Health Organization, the risk of the general public currently remains low, with experts stressing that the hantavirus spreads very differently from COVID-19. Health experts explain that the hantavirus is primarily transmitted through contact with uninfected rodents, like their urine, droppings, and also the contaminated materials that comes from them. While a rare strain known as Andes virus has shown limited human-to-human transmission in South America, experts say that this virus does not spread easily between people and usually requires a prolonged close contact. Researchers from the Harvard T.H. Chan Hospital of Public Health said that the hantavirus lacks the rapid transmission ability that allowed COVID-19 to become a global pandemic. Health experts also note that unlike COVID-19, hantavirus does not appear to spread widely before the symptoms develop, making outbreaks easier to contain through monitoring and isolation. The current outbreak has nevertheless prompted international tracing efforts, with health authorities monitoring the passengers who traveled from the ship to the several countries. And also, doctors said that symptoms of the hantavirus can initially resemble flu-like illnesses, including fever, fatigue, headaches, muscle pain, and breathing difficulties. Also, severe cases may develop into the hanta-pulmonale syndrome, a potentially life-threatening condition affecting the lungs. Despite the growing public health concern, infectious diseases experts continue to caution against the panic, emphasizing that the situation is being closely monitored and remains contained. Global health officials said that vigilance and proper public health measures remain important, but the current evidence suggests that the hantavirus is unlikely to become the next worldwide pandemic. Let's take a look at that video and we see what really happened at that vote where many people got contacted with this virus.
This operation requires the cooperation of 23 countries. I want to remark this. 23 countries are involved in this operation. I want to thank all the institutions, the WHO, of course.
We have been repeating the same answer many times. This is not another COVID, and the risk to the public is low. We're fixated on the ship now, but as you know, the last death from the current outbreak was on May 2nd, so we haven't recorded any death after that. And as you know, there were a number who were evacuated and disembarked, and that's also good news. We hope there will not be any death, but we will monitor strictly.
No commercial flights. No commercials.
Only
No.
military flights?
It depends of the country or similar, or charter or military. Okay, but no commercial.
That that has recently shown the outbreak of hantavirus, and the current evidence, as I had mentioned and as you have seen, suggests that the hantavirus is unlikely to become the next worldwide pandemic. And those are our updates for today. We have a very good package for you here on TV1, but before we head there, let's take a short break and then we come back with more.
Every morning brings a new beginning and a new day. We bring you the news that matters when it matters. From international headlines to the stories shaping our communities at home.
Because where is my ocean? I'm entitled to that ocean.
Welcome back from that short break, and thank you for tuning in here on TV1 as the country Uganda reflects on leadership and also development plus transformation. Today in your health show, we are looking at some of the changes, the growth in Uganda's health sector. Many Ugandans hear the names like Mulago Health Center and also Nakasero Health Center and Mulago, Butabika, all those, but they don't fully understand what these services offer. So here in Your Health, we are going to break them down for you and into a very simpler way so that you can understand them and know where to go to in case you have an issue regarding your health. So we are going to start with Health Center 1, what it is, how it works, and what do they do. So for the Health Center ones, these ones are specifically taken over by the village health teams. So this is the first and also the lowest level of the healthcare in Uganda. And who works there? The people who work there are the village health teams, the community health workers, and the people in the community at large. So they teach people about the hygiene, sanitation, and also they encourage immunization. They also educate mothers and nutrition. They also guide pregnant women to the health facilities, and also they indicate diseases early in villages. So what they normally handle or treat, they handle the minor illnesses plus the health education, and also they refer to the bigger facilities or the bigger health centers. So Health Center 1 is important, and also, have you seen the community workers? That's the first phase of the healthcare in Uganda system, the Health Center 1. And if we are to move to the Health Center 2, and these ones are usually found at the parish levels in your communities. So they offer services like outpatient treatment, the basic laboratory tests, treatments of diseases like malaria, cough, and diarrhea. They also offer antenatal care plus immunization. And the staff who work there are the nurses, the midwives, the doctors, and also the nursing assistants. And also, here, people with common illnesses are treated, plus pregnant mothers, and also the children are needing the vaccines. So, Health Center 2s, this is where Ugandans first go before, first go when they fall sick. If at all you get sick, the first point is going to the Health Center. If at all you get sick, this is the first place you have to head to before you go any further. Now, if we are to move to the Health Center 3s, these ones are found at the sub-county level. They offer services like maternity services, deliveries for the pregnant mothers. They offer inpatient care, HIV treatment and counseling, plus the laboratory services. And part of the staff that work there are the clinical officers, midwives, nurses, and also the lab technicians. And this is what they treat. And they treat illnesses like pregnant women go there for their services. Patients needing admissions also HIV patients can go to the Health Center 3, and also children and adults with moderate illnesses. So the Health Center 3 is very important because mothers can deliver babies there instead of traveling very far. So and also they are just next to your area. So, and if at all you're needing any of this care, you can go to the Health Center 3. Also, if we are to move to the Health Center 4s, this is almost like a small hospital. Here, the services that are offered there is surgery, emergency care, blood transfusion, C-section operations, inpatient wards, and also more advanced laboratory services. They can be found at the Health Center 4s. And the staff that work there are the doctors, clinical officers, and nurses, midwives, and also the pharmacists. And the patients that are normally treated there are the serious patients, those ones that have emergencies, and also mothers needing operations, and they can also go there. There are also the accident victims, those people that have undergone accidents. They can go to the health center FOS. So the health center FOS reduce congestion at national hospitals because they can handle more complicated cases at large. Now, if we are to look at the health centers we have here in Uganda, we can look at one of them, which is Butabika Hospital. It's called National Referral and Butabika National Referral Hospital. So, Butabika National Hospital is normally known as the mental health hospital we have in Uganda here. So here they treat depression, anxiety, drug addiction, bipolar disorders, seizures, alcohol, and also substance abuse. So mental hospitals like Butabika are just as important as the physical health, because these people handle stress, depression, addiction, and these are some of the things that are not easily ignored. So they are being worked upon at Butabika Hospital. And one major change in Uganda today is that the mental health awareness has increased highly compared to the past, where many people feel like speaking out is hard. So if we are to look at the growth and development of Uganda, this is a hospital that we can probably, because it has handled many cases that are in that sector. So it is not just as important. It handles many people, and it's the best mental health hospital we have in the country. Now, if we are to move to another hospital in Uganda today, as we are measuring the growth in Uganda's health sector, the other one is the Uganda Cancer Institute. So this is the main cancer treatment and research center that we have as a country. It treats diseases like breast cancer, cervical cancer, prostate cancer, blood cancers, childhood cancers, and many more. So the services that are offered at Uganda Cancer Institute is chemotherapy, cancer screening, radiotherapy, counseling, research, and many others. So the Uganda Cancer Institute has helped many Ugandans receive this treatment without the country, instead of traveling abroad. So this is a very big hospital we have here in Uganda today. So it does research, and there is cancer screening, and it has served many lives up to date. And if we are to look at another health center here in Uganda, the biggest and the largest we have is Mulago National Referral Hospital. Now, Mulago National Referral Hospital is the biggest national referral and also the teaching hospital we have in the country today, and it handles the complex surgeries we have, and also the emergency cases, plus the specialized treatment, medical training for doctors and also the nurses. And it has many departments like the heart care, maternity, surgery, pediatrics, intensive care unit, which is ICU, and the patients treated here are referred from all over the country, all over Uganda. So Mulago Hospital represents the highest level of government health care here in Uganda, because there is new specialized blocks, improved maternal services, better equipped and compared to the past. So this is a very big hospital we have here in Uganda today. And if we are to go deep into this Mulago Hospital, we find out that it was founded in 1913, Mulago, and it is the most iconic public health hospital, and it is just located at the heart of Kampala, and over the decades it has grown from a treatment center to the infectious diseases to a world-renowned tertiary care and a teaching hospital closely affiliated with now Makerere University, the university we have here, the largest university we have here in Uganda. So Mulago is the backbone of Uganda's public health care, handling the country's most complex cases. And this hospital is divided into the Lower Mulago and also the Upper Mulago, making it the largest hospital in Uganda with a total of 1,600 beds. So its comprehensive services around the clock, emergency care and specialized clinics make it a beacon for hopes of millions of people in Uganda. Now, if we are to look at another health center we have here in Uganda today, is Nakasero Health Center. So Nakasero Hospital is a private hospital known for its advanced medical care with specialized treatment, modern diagnostic scans, surgery, and maternity care, and also the executive health services. So unlike the public hospitals, private hospitals like Nakasero usually provides like the faster services, but at a higher cost. So it has a renewed, it is renowned for its upscale environment and also cutting-edge technology and highly skilled consultants. So it was opened in 2009 and it is favored by Uganda's upper class and international community, offering the world-class treatment across a range of specialties, including surgery, cardiology, and intensive care. So for the beds, we can approximately say that it has 80 beds, and also the doctors are 60 plus, with having the consultants, specialists, and also the general practitioners all over the world. So if we are to compare and look at the health systems we have today, Uganda has seen in the health center, we have seen that the country has had increased vaccination programs with more health centers built and also improved maternal health care and also ambulance services increasing. We also have the HIV stroke AIDS awareness and also treatments. And there is more medical training in the institutions, like we have the Mbarara University bringing in more doctors that are highly specialized, and also Makerere plus other health hospitals. We also have specialized hospitals now available, like all over the country, both government and private. Also, the digital health systems have improved and they are marking a very high record. So health is one of the biggest pillars of the national development, from village health teams to the national referrals. And Uganda health system continues to grow and saves lives every day. So the responsibility also remains with the citizens themselves to come in and seek treatment earlier, also attend a screening, and also the maintaining the hygiene and support one another physically or mentally. So as the country is looking at the growth and development of this country and at large, so understanding our health systems helps us to know where we have reached and where are we going, whether we are going to keep on seeking health, and how better can we protect our communities at large. So those are some of the health centers here in Uganda and how far we have reached as a country. So To our dear viewers, thank you for staying with us in today's show, and thank you for tuning in. This has been your health show. Let's meet tomorrow, still same time, and may you have a blessed day.
Don't miss on TV1. Are you ready to take charge of your future?
I told you.
constructed, with maternal services also expanded, plus ambulances and emergency systems being put into place, and this has improved in many districts here in the country. We have specialized institutions like Uganda Cancer Institute, as we had mentioned them before, plus Butabika National Referral Hospital, Mulago National Referral Hospital, and many more. So today Uganda can manage conditions that previously forced many citizens to seek treatment and abroad. So if we are to look at the HIV/AIDS response, Uganda has become internationally recognized for strong HIV/AIDS awareness campaigns with improvements including the free HIV testing, screening, and also ARV treatment availability, with prevention of mother-to-child transmission, with also community sensitization. So many lives have been served through the expanded HIV services and awareness. So if we are to look at also the maternal and child health, more mothers now deliver from health facilities, and immunization programs have been expanded, with child mortality reducing more compared to the previous decades. So we have governments and partners invested in vaccination, antenatal care, family planning and education, and also the nutritional programs. We have also specialized medical services. Now Uganda has stronger specialized treatment in its health centers that handle cancer care, heart care, treatment for the kidney, mental health, and also intensive care. For example, the Uganda Heart Institute has improved health for all the citizens with the heart treatment services. So Uganda's health sector has become more specialized and technology advanced over the years. So we also have the critical challenges we are facing, such as overcrowding, like in hospitals like Mulago. They still receive many patients, and it affects people through congestion and also pressure on the health workers. We also have shortage of health workers. Some hospitals nowadays have few doctors, few nurses, and also burnout among the staff. And infrastructure may improve, but human resources remain one of the biggest challenges we are facing as a country today. We also have drug shortages, with essential medicines running out, and also patients sometimes buy drugs privately, which is a big problem we are still facing. So access to treatment should not only mean the buildings, but also the availability of these medicines and equipment. If we are to look at the urban and rural inequity, we see that people in urban areas are receiving more access better than the people living in the remote districts. So healthcare equity remains a major concern still today, and this is an important thing, because it still remains as the biggest national conversation that needs to be taken into action. So if we are to look at the success of the government today, we have seen key achievements often mentioned during, for example, the expansion of the health infrastructure, also improved specialized care with the fight against epidemics, and also epidemics we saw as COVID-19. So Uganda has earned the regional recognition for the disease surveillance and also the outbreak response. And if we are to go further, there we have seen that there has been a medical education growth with institutions like Makerere University, and more training health institutions, training the health professionals. And we have seen that Uganda is nowadays producing many medical students, and there has been an increase in the medical schools and more public health training opportunities starting from the village level to the district level. So While Uganda has made visible progress in the health infrastructure and specialized treatment, challenges still remain, such as staffing and also the medical availability and also the healthcare accessibility still remain continued attention. And also development is a journey, and citizens continue to hope for an even stronger health system in the years coming ahead. So as the whole nation reflects on leadership and progress, health remains one of the strongest indicators of the national development. So it's not something that it should be overlooked. A country grows when its mothers survive and also survive childbirth, and while children are also immunized, and even when mental health is highly prioritized, and when every citizen can access quality health care regardless of the time, income, or location. So the future of Uganda's healthcare depends not only on the leadership but also a collective and responsibility, and also investment, and also accountability, and also community participation at large. Thank you. This has been our reflection on the health sector here on TV1. So we, as the country is looking forward to the president swearing in, it is highly important we look back and see how the country has handled in the health sector system. So to our dear viewers, I would like to thank you for tuning in. From where we started the show to now we are ending it. Health, as I had mentioned at the start, this health show, Your Health, happens from Monday to Friday. So let's meet again tomorrow from 4 to 5, and may God bless you and have a blessed day.